coming, and sorry for the technical issues here. All right, so this is our first session for the Pacademia and Student Research Committee. We'll cover cohort studies in this session. And it's not really a session, it's more of a practical workshop where I would like you guys to interact, have fun, and we want you guys to have like a model, a skeleton, a picture of what you want your research to be. Because with this, either you go with cohort or bioinformatics or anything other than that, it'll be a good idea that you could continue with and have a good research outcome out of it. So there's something I would like to start my session with, a sentence, and I'll end with it. So for us to reach a good outcome, you need a good exposure. So remember this sentence, and hopefully by the end of the session, you have a good exposure with a great outcome, inshallah. So, as I've mentioned, this is different than any other session since I need you guys to interact. We're trying to make groups here, we're trying to make researches, ideas, something for you guys to continue with. And as well as, we need you to have fun, of course. And this is different than the year 2s and year 3s know, which is the CBR. This covers something extra. You guys will cover it as year 1s, you'll cover a cross-sectional research-based study. So this will be more different. With the cohort, you'll deal with patients' records, you'll deal with experiments, you'll deal with other stuff other than questionnaires and such. And this is the scheme of how our cohort session will go. So without further ado, we'll go into like the cohort, how is it different than other stuff. You guys have any questions for now? Nothing? All good? Good? Let's continue. All right, so a cohort is different than a non-cohort or any other research, is that cohort deals with, for example, you have an outcome. So you have, let's say someone has diabetes, someone has cancer, or something. You want to know how it started, so you look either retrospectively or you see that someone has exposure. For example, he has a genetic mutation. He has, for example, he works in a company that has a lot of, like, for example, asbestos, has something that may affect their body and such. So you move to look at it prospectively. So cohort looks at a patient's record and you deal with it like you deal with a timeline. So whether you look at it from like the beginning or you look at it from the start point and you move on to the future with them, all right? So this is how a cohort differs than other research. Other research may deal with, for example, a questionnaire. So you send out a questionnaire, you ask them please fill them out. We want to have your idea and such. And you'll just make a study out of it, or it will deal with experimental issue. Yes?
What do you mean by incidence and
Yes, so cohort can calculate incidence and relative risk. What do you mean by this? Is that incidence is like a pool of already known like people that have cancers or diabetes. You know how many are there in this population. For example, there's 1 million in the UAE with diabetes, let's say. So incidence calculates this million and how much each year it increases. And this is done through cohort. So we see how much in the past, for example, 5 years, or how much into the future will it become. And relative risk, it could calculate how the ratio of how suspected this person is to, for example, let's say they have this genetic mutation, how likely will they get this issue? You guys got it? You got the hint? You got the difference? And now cohort covers everything other than that. So questionnaires, experimental, workshop, all right, so it covers everything other than that. All right, so any questions till now? You guys get it? So in this session, what I need you guys to do is either have a laptop open, iPad, or some notes to be taken so that we have a framework of something that you could present to our doctors and you could start with the actual research that you could publish. Good? All right. So we move on. So what is a cohort study? I've talked about already prospective, retrospective. Just to make it in simple terms, prospective, you start with people, let's say, that have, let's say they like to smoke, and then you watch them over the years, and you set a deadline and see what happens to them, like in 5 years, for example. Retrospective does the opposite. You're looking back at people's records. So you look at, for example, the people that have lung cancer, let's say, and you want to see 10 years back, what did they do? What progressed to this lung cancer? So you guys got the difference between the prospective and retrospective. The last one is ambispective, or a combination of both, meaning that it's a prospective and a retrospective. So you see someone in the middle, like for example, he's developing coughing traits, he's developing weight loss, something like that. He didn't develop yet a tumor, and he did used to smoke before that. But you look at the past and you wait to see the progression into the future. So that's an ambispective cohort. Usually, what I would advise us as students to go for retrospective, since prospective, like let's say hopefully you want to do a 5-year study. Inshallah, we'll be graduating in 5 years, so you might not have time for that. But the retrospective is easier to do as a student. So going to the best time to start a cohort research specifically, you can start at any time. I'll be honest, you can start at any time. But usually there are steps that you would need to learn through year 2 semester 2 and year 3 semester 1 and onwards, which is the data analysis. You'll use something called the SPSS. And I'm pretty sure year 2 and year 3 are familiar with it. However, year 1 will take it next year. So that's why I would suggest maybe you start at year 2, semester 2. However, if over the summer you guys would like to learn about it, I'll be sending on the group some videos and some tools that would help you through this data analysis. Is that good? All right. Any questions? Anything? Well, you guys enjoy. Have fun. It's not such a serious session. Yeah. All right. Now for the steps, you guys will have to choose the right team. Now, of course, you have a friend. You'll be kind to him. You'll be nice to him. You know, if he doesn't get to the deadline, you're like, it's okay. But if you want an actual study that you could go years, and a good group, of course, choose the friends that do have a mission and have the same vision with you, and they're ready to start the research and commit to it as much as you are. So if your friends are like that, go ahead, do it with your friends. And if you feel like you have people that are just colleagues that you know, then I suggest that you guys continue with those colleagues and choose the right people that you feel would help you and actually encourage you and take a load off, because we're going to study and do a research. It's too much to handle. So that's why you choose the right colleagues with good teamwork. And larger groups, I would advise that the best, or for example, the golden standard for groups is between 5 to 8, or let's say 4 to 8. Because a larger group, for example, more than 8, you would need more. For example, in cohort, you would need more hospitals, clinics, and more connections. So if you have less connections with a big number of authors or big number of contributors, they'll be like, this is a weak study. So if you go for large groups, go for more university hospitals, more clinics, more anything, or more contributors. So that it will be a valid research. And we'll go through how the steps of finding a good hospital and such, so don't worry about that. And the division of tasks improves your efficacy. Make sure that everyone has a hand in this research. Don't take everything for yourself and then be greedy about it, or don't give everything to other people and be relaxed and lazy about it. So always have equal amount of tasks, and always set deadlines so that you know, okay, this is the starting point. And I'm pretty sure you guys are in the same year, so you'd know when you have exams, you'd know when you're fully stressed. So maneuver around it and try to set deadlines that you guys could reach to. All right, that's basically how to choose the right team. Now, choosing the right topic. Who here is a year 2 student, or let's say a year 3 student? All right, year 3 students. How do you choose a topic? Give me just an idea. Then we'll go to the year 1s and see. Give me.
Anything you find interesting.
Something you find interesting, correct? Yeah, something that you feel like you could yourself could be impactful towards it.
Something
How about you?
Something
Yeah.
that can be backed up.
Exactly, something that could be backed up. For example, there was yes, exactly, literature review, and we'll go over how to do a literature review as well. Year 1s, do you have any ideas, or even if there's a topic you want to tell us? Yeah, open up now. Anything.
Something that hasn't been done before.
Exactly, something that hasn't been done. Usually it's very hard to find something that hasn't been done. I'm pretty sure that inshallah next year when you go into year 2 and they ask you to define something, find every single thing has something that has been done. But a good way to choose is that you could focus on topics that are not commonly studied, meaning it's everyday item, but no one thinks about it. For example, my CPR project was about acrylamides. It's not something that you would think about the first thing. It's basically when, for example, you cook the rice and you overcook it, it burns. Those starches are cancerous, but no one knows about it. This is something that you wouldn't think of, but it's actually very useful. I found just one journal that published it, and it was a Q1, meaning a TOPS research. So I suggest trying to think of everything, everyday items, everyday encounters, and you could start a research from that. Or you could also do something that's new, discover like a treatment. And you could do, for example, you find a treatment for like a cough syrup or something that helps with depression. So you want to see the effect of it on depression, and you could, for example, see how people are taking it. That's, although it's new and a simple study, That's a really effective study and will get you a good journal. So yeah, ensure the topic is feasible with available resources, meaning that you have idea about the thing that you are like researching about. There is some backup literature. If it's something totally new, at least know the components of it, whether it's a component like a compound you're looking into, treatment you're looking into. Just learn about the treatment, learn about the compound. So see something that has something that backs it up, and learn to identify gaps in the existing research. We'll cover how to identify a gap in a research, how to look into the methodology, specifically limitations and such. Lastly, use personal research experience as guidance. So go look, ask the year 3s, your year 1s, I'm pretty sure there are year 2s, ask the year 3s, ask the year 4s, ask your doctor supervisors and such, and they'll tell you their experience and how to overcome those issues. So I've been mentioning literature review much, and now I'm setting the stage for Mohammed to explain it well. So thank you very much, guys.
Hello everyone. So for the literature review, you guys tell me, what do you know about it? What is literature review? Let's see. Yes.
One of my friends was working on literature review, and all I know is that she, along with her roommates, went over almost all the articles that they could find related to their topic. So they just screened for articles.
Perfect. Yes.
There's different types of literature reviews, so it depends on which type user is, like systemic, meta-analysis, and then literature reviews. So it really depends, but the general idea is that you're collecting a bunch of data, like articles, and you're analyzing them or you're discussing them.
That's another way of saying it. That's perfect. What else? Any other ideas? Okay, so yes, the back.
the gaps the other research that try to do.
That's another point as well. So all of those three answers is what you want to do in terms of the literature review. So I'll tell you how I do it, and I'll be fully honest. So in terms of literature review, okay. So how I personally do it is that I honestly go through ChatGPT in terms of getting ideas. Let's assume, me personally, I have zero idea of what I want to do. I have zero clue. So, but at least like I have some field of interest. So for example, for me, I'm interested in neurology. What I personally do, I go into ChatGPT, brainstorm some ideas, and I ask, what possible topics is there regarding neurology? And then I get a set of cognitive disorders and so on. I keep on doing and searching until I get a proper idea that I could actually use. Now I move into stage 2, which is I do a proper real literature review now. I go, and I'll be fully honest, I open chat and I search. I write down the exact topic I have in mind, and I search. And I ask him, give me everything you have. Which is basically what's your name, please?
Shazia.
Shazia, nice to meet you. So, Shazia, what have been mentioned here is exactly what I'm mentioning here. So, afterwards, I collect the literature, all of the literature, all of the articles, and now I get into the real deal. I open each article, I go over it, I look at the methodology, how they have done their study in relation to my ideas. So for example, if I'm doing a topic about neurology, perhaps their approach, their methodology could be cross-sectional. It could be something in a way where we can find a limitation. There are some studies where they actually do the same, for example, idea I have. They do it cross-sectional, but your touch to that is where you actually do it as a cohort. By the way, guys, do you know, you know what is cross-sectional studies? Everyone is aware? Okay. Cross-sectional study is basically a survey-based study. You do a research that is survey-based. That's simple. But the pure definition of it is when you collect a sample at a single point of time. Okay? So it's simple, فاتح, survey-based study, يجمع participants, and then you distribute, طلع يجيب الداتا. That's cross-section. Okay? Okay, so that's how I do my literature review in terms of getting an idea of what I want to do. There's 2 stages to this. This is the simple one. The other stage, I will come to it in a second. Now, I'll tell you a trick. I'll come back to the previous slide. I tell you a trick of how I get actually some interesting researches. Sometimes I found an interesting, very interesting research article, and I go into their limitations. And by the way, some research articles, they have their limitation written in the limitation section, but some other research articles, they have their limitation written in the discussion or in the conclusion. طيب. What I do as a trick, I go into their limitation, I go into their caps, and they always mention something about a mistake they did in their study, a limitation they have in their study. I use that information and I revolve my idea around it. And I add some extra, some additions to it. It becomes very like, this is a hack I use honestly, and it works very well with me. طيب. Back to here. A key question I ask myself in terms of literature review is what I'm thinking of, the study I'm doing, is it actually novel or not? Can you guys tell me what do you consider a study being novel? Okay, let me redefine. Just one second. Novel, other words to it, original, in other words, something new. Okay. I just answered myself. You want to say something? خلاص? Okay. Now, I have a question for you. A study being novel, something new. Is it a study where you do something from a complete scratch? Go ahead.
Not necessarily. It depends. It could be new in the region, or you're adding more to the topic, so it's not exactly new.
Okay, so you're saying anything?
No.
Okay. So what you're saying, and you're doing something, a change, to come up with something new.
Mhm.
So, from scratch, you're saying it's not necessary. Any other opinions? خلاص. And I agree. I totally agree. When you do something from a complete scratch with no reference at all, in my opinion, that's very horrible صراحة. لأنه you don't have a backbone. You have to have a reference study to have as a backbone, so that later on you can reference that study and you say, no, Allah, I did this study based on a reference that has been done before, but that has been done not in the UAE, somewhere else. Now, what I do, let's say I have a topic, a retrospective type of methodology, and I find that this study has been done in the UAE. Okay, I love the topic, but I want to do something about it. What I can do is I add some variables, parameters. I will tell you what do I mean by them. Other things I would do, I would try to change a bit in the methodology in terms of, I would change the retrospective aspect, I keep it, but I combine it with something else. I'm not sure if this is advanced for your stage or not, but it exists. What do I mean by that? You combine a retrospective, you go into the patient records, you take these and you combine it with a, for example, cross-sectional type of study. You will distribute a survey for a different target of population. When you combine these together, you will get a unique methodology. So I'm just throwing it out there as an idea for the future for you guys to have. طيب. Another thing, what's your name? Amal? Okay, Amal, you mentioned something about a new population. Is that right? I 100% agree with it. Actually, another trick I do, I go and search for a lot of other articles. Those articles that is not done in the UAE, مثلا in the US, in Canada, حتى in France, mashallah, they have very interesting topics. When you search these out, what I would do, I would kind of replicate that study. It's a small technical issue that has occurred in the recording, so I'll just be covering the part that was missing. So what I was saying is that a trick that I will be doing in some of my projects is that
I would go look into the research articles done in different countries, and if I found one, and that one has not done that much. So, for example, maybe it's done once or twice in one, two countries, something like that. What I would do is that I would take that research article, I take the idea of it, and I kind of replicate it and put it into the UAE population. In that way, my study is unique. But of course, you would be doing changes that suits the population, and you would add your own touch. Yani, it's better not to fully replicate it, but at least you got the core idea. It's 100% doable, and it's actually good for you and for the place you're doing it in, because you're adding a new data in that country, and that's what's needed أصلا. So that's the part that's been discussed here. And here I've shown an example of a limitation of a study. If you want to just go through it, read it, and how it looks. So, for example, in this part, it mentions that additional cohorts is needed. I have referenced the study here. It's basically telling us that we need more cohort studies to verify this kind of data. So this is, for example, an opportunity for you to use this type of study and do it in the UAE. So you got the idea of it. Um, that's the basically regarding that. Now, when it comes to the choosing the right PI, what has been discussed is that PI, which is a principal investigator, which in other words means a supervisor, and what you basically need is that you need to choose a supervisor, and it is actually required to choose a supervisor for your study from the University of Sharjah faculty, and you correlate that doctor to the research idea that you're doing. So, for example, if you're doing research about pharmacology, you would pick a pharmacology doctor. Why? So that he can actually help you in the methodology. He gives your his opinions on what you're doing, the approach you're going for, and all of that. Another thing is that a very big advantage where we have our faculty is that when you approach a doctor here or a professor, they would help you a lot when it comes to the connections to UHS or even other hospitals. They know the physicians that's working there, so just a simple phone call to facilitate things and all. And that's basically it. Yeah.
Before I get to the ethics section, I think I give you guys time to think of something you want to research about. I want to hear like a lot of people and their ideas for research. عندكم idea? فكروا يلا. Think of an idea. I need you guys to think of something. Think of an idea. Okay, let's listen to their idea. Yes.
Which surgical procedures have the most to redo the surgery, whereas complication or like recover, for example, knee surgery, joint surgery.
Yes.
You have most of the time you have to redo the surgery.
Yes.
Or maybe herniation.
صحيح.
it will
So I understood your point.
And you have to do another surgery.
Could you give me your name?
Malak.
Okay. Alright, Mohammed's my colleague, that's why. Alright, Mohammed. So you mentioned that the research you want to do is, for example, a surgical thing that you want to look into the surgical, let's say, follow-ups. See which one has the most one that, for example, mistakes could be done or the body's physiology causes that they require another surgery. Alright, so here, let's apply to the ethics. Are you guys thinking of idea? I think you guys have to like formulate something if you want to start the research. Think of an idea as well. I'll wait for another one to give me an idea so that we could go along to the ethics. Think of idea. عشان جد we could apply it to our research. Ideas? No ideas? Okay. And then policies of hospitals.
Yeah.
And how would you apply it to a cohort, let's say?
As in how, for example, you have a new program for making administration easier in hospitals, so you're testing it.
So you could say the index, or we could talk about this, but the starting date, and you see how well it has been. All right, that's a nice idea. So, okay, yes. Yeah.
We could see the efficiency. How should the treatment from the doctors like getting more patients? Like, is it?
Efficient treatment.
Yeah, like is the treatment getting worse when we are taking more patients for the doctor?
Nice. Okay, so now we have 3 ideas, and we're gonna apply to the ethics. So the ethics is kind of like the cornerstone of your research. Why? Because till now, when I come back to write the manuscript, so I could publish, I come back to the ethics and see the steps I took to make this research. And if you see the ethics form of the university, it's really long. And you guys will have a bit of trouble, but it's all right. It will be easy if you guys divide it. At the beginning, they'll ask you to make a title. So for Mohammed's research, what is the title that you want to give it?
Maybe like.
If you want, like I could give you a clue. You could give it exposure. Yes. For example, exposure. Then you follow to the outcome population. For example, the exposure is, let's say you were doing research about keto diet. The exposure is the keto diet. Effect on, what's the outcome? Weight loss. And what's the populations in adults in the UAE? And you talk about the research design, it's a retrospective. We're looking at how well this diet has went over. So, Mohammed, for the research idea you had, what's the exposure? Let's say the exposure for this is surgical let's say, surgical issues, for example, a herniation. So the exposure is the herniation on or affecting the surgical outcome or healing process in the population of, for example, obese patients, because we see that obesity usually has a herniation and all that. So this is, for example, a title that you could start now with the research and writing the ethics. What else? Aman, your idea. So what would be the exposure? Or let's say the thing you want to test. It's the policy, yes. So the policies and their effect on the efficiency of the hospital in the UAE. Someone is, yes.
One of the ideas we have is, for example, when it comes to my colleague Mohammed's idea, we can have it even kind of zoomed in the scope of, let's say, grafts-related surgeries that have the highest incidence of occurrence, or like basic injection and stuff like that. So these are one of the things we're thinking to do when it comes to a cohort study. That we can have a perspective view over whether these graft-related surgeries
have a good outcome at the end. Yes. So I hope you guys are writing down an idea and trying to formulate for it a title. And research design, like نضال. عندك فكرة? Okay. All right. So now we move on to the methodology. The methodology is composed of multiple aspects. First, of course, the study population, sample size, and all that. What's included in the study population is, for example, you want to include certain people, and usually I would suggest adults, meaning 18 and above, since if you want to take, for example, you want to look at pediatric age, there's more ethics requirement and a longer process for it to be accepted. So my advice for the study population, look for adults and include almost all the population of your country. So the migrants and everyone that, the expats, the locals, all the population within this study. So that you could cover all aspects of the nation, and it's like a mirroring. You're mirroring the study to the actual population, and this ends you in a better journal. And the sample size calculation, this one's, you could just open any website, right? Sample size calculation, and they'll ask you, okay, what's your study about? I'll give you a sample calculation. It's pretty simple. Now you have to explain how will you obtain this data. And why is this important? Because when you go to other hospitals, they'll see and look into your methodology and how you'll obtain. Basically, the data collection is you'll explain. I'll be reporting to hospitals, asking for their approval to take patient records and look into, for example, this year to this year and such. I'll describe the timeline in general. And you all describe this into the data collection, and you complete this methodology part with the variables and analysis. The variables, we have a big section in this PowerPoint talking about it. However, the analysis also we do, but the simple part in this ethics, you only have to write, I'll be using a certain program to analyze my data. All right, and the starting points and follow-ups and such. In Cohort, the thing with it is that, as we mentioned, you either look to the past as a retrospective, or you take a population and look to the future. So the starting points, you have to define them. Like when I went to hospitals asking for their patient records and such, they were like, okay, we could give you from, let's say, 2022 till 2025, since, for example, 2026, we just started with it, and and we don't have it yet prepared. So you have to define your population to them, and if they don't have it, you could switch to another hospital or such. And as well, you have to have like something called a follow-up start. So basically, whenever you start, for example, you're doing a diet or you're doing a new treatment, you have to see the follow-up, like what's going on with this patient. And for follow-ups, you have to set a date that's validated by a different journal, and this will discuss about how to find this validation. And you start setting the date. So, okay, I want to start seeing patients or the patient records from 2022, and then look how they've done in, let's say it was January 2022, how they're doing in March. Then I follow up on how they're doing in September, and then how they're doing in December, and then how they're doing in the next year. So you have to give a full timeline so that not only the university ethics committee could understand what you're looking into, but also so that you could showcase this to the hospitals and clinics that you would like to apply to, and it will be clear to them and easy for you to access the patient records. Now, after submitting it, this is not really a step, it's more just you submit and you're waiting. Now what to do? If you're doing a combined and you would like to do a questionnaire, start on the questionnaire, try to finish it until the ethics come. Usually for the university ethics, it takes 2 weeks to a month to obtain, and sometimes it may take longer. So I suggest try to do something like prepare your methodology, try to write your questionnaire, try to understand the topic because you'll be tested. Like I remember, and we talked about this when you go to hospitals, they'll keep asking you a lot of questions to see whether you are understanding about this concept that you just started. Now we'll be moving on to the literature review and how to obtain the methodology and results, and Mohammed will be explaining this part. Hello.
Back to the literature review. And this is stage 2. Now, your objective here is to do literature review. We're done with the topic, but we need to do a literature review of what you want to actually extract from those patient records. I just want to make sure of something. Do all of you understand what is a retrospective study design? A raise of hands, who knows or understood what does it mean to have a retrospective study design? Okay. I feel like they don't know you. I'll just in case, I'll repeat it. Retrospective study design is when you go back into the patient records. You go back in time to the patient data موجود في الهوسبيتال, and you take those patients' records and you start analyzing them. خلاص؟ طيب. And those records, there's a set of data, يعني في معلومات انتم تريدون تطبقوها صح؟ طيب. هاي المعلومات, okay, انت you won't go to the system and just start taking things out of the blue. لا, you need to go prepared. You need a set of things pre-planned before you actually go to the analyzing stage and go to the hospital. So I will show you how my team and I have done this type of literature review, and I'm telling you this is literally a gem. We worked so hard into this to figure out a plan where you actually get a very nice end product. So, step 1, again, literature review. We have a set of articles, the closest matching article related to your idea. You pick it. If you got lucky, you find something like this. Take a moment. What are these? These are parameters. What do I mean by parameters? These are the set of things this research article have used in exploring what's inside the patient records. So let's go through it. This is a diabetic related study. So what they have written in their papers and what are the things they want to extract. Let's start from the basics, demographics. So they said they want to get the age, the gender, the race, and this is the set of things they have chosen, the body weight, mean body mass index, and they have the categories for it, and you got the blood pressure measurements, systolic, diastolic, the lipid profile, what's inside the lipid profile, total cholesterol, HDL, LDL, triglycerides, and the list goes on. This is extremely important. This is extremely important for you to research about. Now, let's say your research idea is about diabetes, and you got lucky, you found this exact article, and you got lucky, and you searched the methodology, and you searched the results of that article, and you found it. Now, I'll tell you what I have done here. I just picked the things that was relevant to our study. So this is the star there. These are the things that we picked. And now I'll move into stage 2. By the way, it's 4 stages. That's how we have done it. Stage 1, we found the reference. Stage 2, خلاص, we organized the things that we picked. And we got something like this. Ignore these for now. This is the parameters I'm talking about. And these are the things partly of what we have chosen. We want to extract. With me so far? You can stop at this stage, but I recommend you move forward. Why? If you notice, most of these variables, the parameters, when you pick or when you extract it from the record, you extract it as numeric. Yani, age, you're gonna type it down. Number 38. Gender, okay now. Baseline weight, addicted, the weight of the person, and so on, and this goes on. Now imagine you do this for like 100 plus patients. Is this applicable? Is this easy? No. So what we need to do is make it easier, and that's what we propose, and that's what we personally did. We move into stage 3. We turn this from numbers to MCQ categories. Stage 3. Here you go. This is how it looks. This is what my team worked. This is basic things, just for demonstration purposes. Notice that's how we organize them. So the age, we categorize them into different groups. Gender fine, but we turned it at least to an MCQ related. You have the baseline measures and baseline measurements such as the baseline weight, and you've got the different categories and so on. Now, you need to ask yourself, is this thing you're doing, is it validated or not? You're changing the numeric into different MCQ questions. Is this valid? هل هذا شيء صحيح? Raise your hand.
Can you repeat that?
Okay. Which part?
The very last thing.
Okay. The question.
Yes.
Again, when we have convert the numeric data, in numbers, the age of the person is 38. We converted that into an MCQ. حولناه إلى different categories. The patient age is from 18 to 29, and then 30 to 39, 40 to 49, 50 to 59, and so on. This is just a minute. This is a basic, I know it's a demographic, but the same would be repeated for example, baseline BMI, like for example, the detailed things you need to extract, the actual information. So again, this is a diabetic study. One of the parameters we are trying to get is the baseline BMI, and we divided them again into different categories into MCQ, and I'll read it for you just in case. Here you have the baseline BMI, and the way we did it, instead of typing it down, what's the baseline BMI of that patient is, instead of that, we divided them. Less than 30 is overweight, 30 to 34.9, 35 to 39.9, and the list goes on. Now I repeat my question. What am I doing here? Is it valid or not?
I don't think so.
Okay, that's an opinion. Yes.
I'm
Go ahead.
confused because could you show how the data was categorized in the original reference table? No, the original.
The original? Okay. Ignore these. These are actual results and analysis and such. What we care about is what they have taken, but in the research article itself, they mention like how they actually done it and such. What's your exact question again?
I'm kind of confused because ultimately into.
Can you see now? Did you get it? Here, what they're doing, they're not dividing age itself. Here, they are getting some results they got based on analysis. It's deeper. That's why I said this one, I'm not sure if I said, but I found this from the actual results. You may find this table either in the results or in the methodology. In the methodology, they will not include all of this. But what we care about is this. Okay? Now again, back to the question, is that valid? One opinion is no. I'll tell you. Okay. Now, personally, I disagree. Why? Because we can turn it into something valid, and I'll tell you in a second. Yes, we like.
We have input. Now, I believe when you mentioned categorizing stuff, for example, let's say we have a very huge sample size. Okay.
Okay.
So if we have every single individual write his age, for example, and we just have to analyze it one by one, it's gonna make it really long. But so for example, such categorization should be maybe based on previous research, as you said, because we have a backbone. Whereas scientific categorization should also be backed up by like a valid research, or should be scientifically proven before we actually provide such categories.
That actually brings me to my next point. That's very, very true. I'll tell you why now it becomes valid. Because when we go into the literature again, and we go, for example, I'll give you an example. I have another picture here, which is better. Here is the systolic and diastolic blood pressure, very simple. And notice, usually, perhaps you can type it down, simply, but what we have done is divide them into different categories. Okay. Again, how is that valid? Is when we go into literature, we ask for a validated reference, an actual official place, an official article saying that the actual divisions of the diastolic and systolic blood pressure measurements are actually divided in this way, and each one of them has a definition. For example, less than 120 in the systolic blood pressure is considered normal, and that came from a validated literature. Did you get me?
So it would be another guideline, for example.
Exactly. That's the word I'm looking for. It's literally a guideline. Now, this is an example, systolic and diastolic. Now, other things, same idea. You will go for different guidelines. You will go for different literature to find and validate that this thing, that what I have done is valid, and I have taken it from a validated source. Now, with these, my results and my outcome will be much simpler. I'll tell you how. We are currently in stage 3, where we divided, we changed the numeric value into a different MCQ from different guidelines, and all of which are validated. I'll move forward and come back to you. I'll move forward with stage 4. Now I'll tell you how it became simpler. Imagine 100 patients. Can you have a list of 20 things and type them number by number? It's going to be much harder. Okay, that's hard. Point number 1. Point number 2, when you go into analysis, when you're analyzing your findings, if you have experience with CBR, you're familiar with survey-based studies. Those studies are mainly MCQ. صح? Hence, you're familiar with how you can analyze MCQ-based questions. Make sense? It's simple. Here, that's the idea. That's the final outcome we're trying to reach. Simplicity. So, if you notice, this is our stage 4. We turned our MCQ questions and we turned them into a Microsoft-based questions. And حطيناها في Microsoft, we put them into Microsoft forms, and through that, we go into the system, we open the system, we see what we need. For example, the age of the participant, our patient, the age of that person, and we fill it out. And we go for every question and every question and every question. Start to click now? Yes. So far, is everyone with me? Okay. Now, In Microsoft Forms, you're filling it yourself, and now at the end of this خلاص, you can just press submit, and then you move forward with the second patient, to the third and fourth, and then you get a total of 100, and you get 100. Afterwards, what will you do? خلاص, simple. Analysis based on what you already know from your CBR. That's it, that's the whole concept.
I have a question, please.
Yes.
Because I didn't put on the first part. For cohort, minimum is 100 ولا أنت expected رقم
I
10?
just chose it.
Okay.
Yes.
So you have to decide that at the beginning.
100%. Any other questions so far? Okay. So that's our 4 stages, and here's the things if you want to. We'll send you also the PowerPoint for you to look at as a reference to get more ideas. And this study again, I referenced it back. This is the same study I referenced at the beginning of the PowerPoint. It has the similar tables that I referenced in my examples.
So just a few clarifications since some people were confused about this part. So the idea of this, when we're defining what our age groups, the divisions of the age groups or divisions of the baseline weight, or for example, dividing systolic and diastolic into different parts. The idea here is that what we have done, we went into literature, validated literature, and we checked a guideline, a reference where it says that they have divided my blood pressure into this and this and that. So, for example, the systolic blood pressure, as mentioned in the session, here in their research article that is validated, they have said that they have divided the parts into, for example, less than 120 is normal, 120 to 129 is elevated, 30 to 139 is stage 1 hypertension, and so on. So we have put that into like MCQ, nothing, and you just write it down. And then later on, when you go into the records and you type things down and you see, for example, this patient systolic blood pressure is 120. So you go and just pick it up. So you just choose it. Another example here, for example, the baseline BMI. So we went into a literature and we checked what's the divisions, the correct divisions we should write when it comes to the baseline BMI. So in that article, they have divided it that way. So less than 30 is considered overweight, 30 to 34.9, that's considered obese class 1, and so on. So we have written that down as it is, validated, everything is well. And then when you go into the system and see that the BMI of this patient is, for example, 32, in Microsoft Forms, we'll just tick it. And that's it. And you move to the second one, and so on. That's the idea.
You guys want to practice? Okay. We'll practice the 4 stages together. Does we have time?
Not much.
Not much?
I'm looking maybe the parameters for the title.
You know the
Yeah, the
parameters?
parameters.
Okay. We had few studies. One of the studies, something about surgery, orthopedic, something like that. Can you repeat the theme?
Like determine what are the surgeries, and you have the highest risk of like yes failure, and you have to make another surgery in order to solve the complications, or surgery itself failed and you have to repeat it.
Okay. So let's brainstorm together. So you said it's surgery related. Let's put the theme related to surgeries. Tamam? Let's pick the things we need, or the things we need to extract from those surgeries. And you're going to the hospital, it's surgery, orthopedic surgeries. You're going into the system, but you need to be prepared. You need a list of things to extract. Those are the parameters I'm talking about. But let's brainstorm together what are the parameters for this type of study, and what things can we come up with?
Types.
Yeah.
Repeat the study.
So the study is
Surgery.
surgery related,
Yeah.
between surgery and orthopedics.
Corrective surgery, like surgery that failed, and they have to like redo the surgery or do a corrective surgery for it. Yes. We should maybe take into consideration the weight as well.
Yes.
Yeah.
So one is the weight. So
Technique, maybe?
Yes.
technique 100%. That's absolutely correct. What's
Age.
Age.
age, demographic, perfect. What else?
the surgery itself being performed?
Perfect.
The condition of the patient itself. Like maybe
So
the
any
patient's reactive.
comorbidities, yes. Comorbidities and
Yes.
Comorbidities. Perfect. So we got total of 5.
Profession. Profession.
Profession. Depends. على حسب how you're going through it. But it could be a parameter as well. Correct.
side effects after surgery.
100%.
Success of the surgery.
Success rate. ممكن. Yes. What else?
Adherence to medication post-operation.
Adherence. Perfect.
Post-operative complications.
Complications. Yes. 100%. So let's pick 3. Complications, side effects,
Procedure.
Procedure time.
Yeah, type.
procedure. Let's make it simpler. خليها something else.
Wait.
Wait. Again, what are the 3? Wait, complications, side effects. Okay. Now we have a set of 3. Wait, complications, and side effects. Let's go through 4 stages. Stage number 1, we finished it already, and the parameters. And I'm assuming and we got that parameters based from literature. Those are my parameters from literature. Very important. طيب, that's stage number 1. Stage number 2, I picked it, I made a table, I organized my information. Stage number 3, let me show you. Here we are organized everything. Stage number 3, categorize. Perfect. We changed our baseline weight. Instead of typing it into numbers, we made them into categories. Side effects. Instead of typing the exact side effect of this person,
we give a list of the most common 10 side effects.
exactly. And the third one,
Complications.
complications. With that, you categorize everything, and then when you finish stage 3, you move with stage 4, putting those exact things into Microsoft Forms so that you go into the system, you just go into the question that you formed for yourself or the thing you're trying to analyze based on weight, you wrote it in the MCQ and so on, complications, side effects, and you're submitting your results one after another, and repeat and repeat and repeat. Okay? Did you get the idea?
Yes.
Okay, with that, I'll try to sum up quickly with this part. It's still very important, but for the sake of time, when you're actually approaching hospitals, for the hospitals, you need to understand that you will possibly be approaching 2 divisions, either a public hospital or a private hospital, each with a different, let's call it different technique. So you go into public hospitals, and I'll give you the cheat code for the public hospitals. You have Dubai. What are these basically? These are the things you need to approach in order to get the ethics from. So for a public hospital, if you want the records from a public hospital, you need to apply for the ethics of that hospital. So you will check, is that hospital private or public? If it's public, you need to check where is that area. Is it in Dubai? If it's in Dubai, you go for Dubai Health Authority. If it's in Abu Dhabi, you go for Department of Health. If it's for anything, any other place, you go for Mohab, and that's the most famous one. You go, apply تفتحوا Mohab, and then you go into the ethics, and then you submit the ethic form for that. By the way, the ethics there is literally very, very similar of what you already have been done. You already done in the research ethics in the university. So you just copy paste, but maybe there's minor changes in it. Okay? Number 1, public. Yes, question.
So if we're doing a research that involves having to go to hospitals, we have to apply for ethics at the university and at the...
Yes, very important. They will not let you to go in without ethics. حتى UHS.
Wait, question? Sorry.
Just a question. Do we only need like one hospital or multiple hospitals?
It depends what your approach.
It's always better. Always better. But can we do it about
Multiple, 100%. You can do it multiple.
نفسد my research is not about like from the university. I don't need an ethics record from the uni as well, right?
If you're a student, is it undergrad you had?
Yeah, you're
undergrad.
Yeah.
Can you repeat the question?
أنا ما بعملها مع الجامعة.
Okay.
بس هيك مع نفسي.
على هذا السنس you have to do. طيب. So far good with public hospitals. If you're approaching a public hospital. طيب. What if you're approaching a private hospital? مثل UHS. UHS is a private hospital. طيب. We're done with the ethics approval بالجامعة. You're going for ethics approval to UHS. All private hospitals have an internal ethics. They don't follow a government. They have their internal ethics, they will take the form, and then they will tell you this is our reply and so on. Now, most famous questions, what we initially had before we were experiencing this, which is faster? Is it faster to go for public hospital? Is it faster to go for private hospital? Does it matter or not? طيب. What's faster? 100% is going to be private hospitals because they have an internal ethic, and those internal ethics, they usually finish faster. Things are speeding up. But in the public, it's a government level, so it makes sense for it to take longer. Our experience, UHS would take around 1 to 2 to 3 months, depending on the pressure they have. But in public hospitals, they would take around 2 to 7 months. It's possible. Even كمان depending on the pressure they have and a lot of factors, but that's the range. طيب. You should ask yourself if you're gonna find everything you need. يعني whatever hospital you pick, you will find everything you need or not. You should consider that the private hospitals, they don't have insurance. So معناتها the patients could come only once. Therefore, your results would be one visit. So if you're doing a retrospective, you would prefer them coming more than once. صح? Yeah. So in this case, if you need them to come back again and again to see their results, their labs and such, your preference is going into the public hospitals, but that does not mean private hospitals doesn't have that. They do have that. But it's limited and the data may be missing. So put it in your consideration. It also plays a big role in the topic you're doing. Maybe the patients would prefer some to go to private hospitals, and that's an advantage depending on the topic. Okay? I mentioned everything here already.
Excuse me, I
Yes.
have a question.
Yeah.
Regarding the timing, بس أنا حكيت the follow-up. Is it
Yeah.
okay if I go back like way back in time or not? ما في أي
It's-
مشكلة.
It's
I
you can
choose.
exactly you can choose whatever you want. Yes, but also keep in consideration when you make a study, some studies we prefer them to be
أقرب منها.
exactly. Yes, so that's your study is actually new. Plus tip, you could go very back in time, but you put it into 2025 or so.
Yeah.
It's still considered. Yeah. طيب. Any other questions? Yes.
Doesn't the insurance thing also affect prospective studies because the patient would come once and then not follow up?
Yes.
It's difficult for you to be able to.
100%. It has an effect on both aspects. The ritual, and they don't, you just come once. And the prospective studies, perhaps, they visit once and they don't come again. That's an issue. Good. طيب. Any other questions? Other considerations, I go through it. You should consider the distance because they will not allow you to access the system from your home. You have to go there. So keep in mind that it should be close to you and you're probably going to go repeatedly. Another ethics approval, I already talked about that. And another very important thing, you will also need a PI, principal investigator, from that hospital. Yes, you need it. That's one of the conditions. Principal investigator. So it's like a supervisor, but a mustashfa. So you need that. Now you can't talk to that person. يعني ممكن they say no PI, I will be the first author, blah blah blah. Some others they will tell you no, it's just on paper. We'll call it and I'll be the PI just for the sake of the ethics to move on. But in reality, I'll just join you as a co-author and everything will be fine. It happened before.
Who is the supervisor, the doctor, what
The supervisor is a doctor, a physician. يعني you need a physician from that hospital.
Okay.
So preferably if you're accessing, for example, gynecology records, you will go to a gynecologist and take their permission, have the preference, and then ask them, "Yalla, I need permission to do the study, to submit the ethics." So let's do that.
Like a communication.
Yes.
Yes, it's very important to set the stage and talk to the PI and the physician there and talk to them, make it clear. It's fine and it's not معب. Okay. Now, when it comes to the data collection, it's basically, some hospitals, they would give you an Excel sheet, and those Excel sheets, they would have amarans. شو يعني amarans? Amarans is basically
Medical record number.
yes, medical record number, and it connects you to the patient. So they give you an Excel sheet and so many patients, and they tell you these patients are related to your specialty that you're trying to figure out. So all you need to do, go to the hospital, tag the amaran, you'll get everything about that patient. Some other hospitals, they will not give you an Excel sheet until you go and access the system, but use the filter. Okay? And the bar. Were there any questions?
For the bread and butter for the data analysis, simply all you need for data analysis is SPSS. That's all I have to say. I'll be sending steps videos like step 1, step 2, step 4 on how to do the data analysis. But it's such an early stage you guys are in. First, choose the topic, follow the steps that we've told you guys before. Then we'll come to the data analysis. And of course, we're going to follow you guys up, even if you guys continue this research, year 1, year 2, year 3, year 4. We're going to be there to follow up and make sure you guys are doing well. And when you see the results, usually, after writing the results and all that, you prepare a poster, an abstract that you could submit to conferences and such. And so that you could sum up your findings. It'll be easier for you guys to write a manuscript when you have all this written down. So the abstracts, making a poster, it'll be very easy. Now, I'm not running through it. Or if you guys have any questions, you guys could stop me and ask. Yes, sir.
Can you give me a timeline of how long all of the approvals took, going
Yes.
back and forth?
So honestly, we've started, you could say, mid year 2, semester 2, till now. So about a year, you could say.
A year.
Yeah, a year. Forget getting ethics and such.
Until with ethics.
Oh no, with the ethics, yeah, a year. Yes. Yes.
A year, and you wrote the manuscript? Or
No, not yet. Still, we're moving on forward. Yes. So it does take much time because you're looking for ethics of multiple different hospitals if it's a multi-center, and you're looking to write a lot of patient records and such. This will take a lot of time. So give yourself around 2 years or a year and a half to get your things done. So just some bonus advice I'd give for starting. Now for the teamwork and study life, balanced research with academic study, as we mentioned before. You have your teammates. And you guys already know that you're medical students with exams and work to be done. So set deadlines that you are all sure that you could fit. And the authorship, don't fight over. And something that Prof. Mohammed told us before is that you're an undergraduate student. No one will look, were you the first author, were you second? No, it doesn't matter. The most important thing is that you participated and you have contributed in this research. And no matter where you are placed, they'll look at it as a gold, like, oh, this guy did a lot of research, this person is good, we'll be hiring him and such. It's only important if you're entering the academic sector, if you're becoming a professor and such. And yeah, journals in general. First is, I think Mohammed knows best about attending conferences. You told us before, yeah.
Yes. So in regards to journals and attending conferences, so what I recommend, there's a trick where instead of going into publication straight up, what you can do, go to a conference. Some conferences, I'm not saying all of them, some of them, when you go and apply and such, and they accept you, when they do, they will help you publish that article. So they will publish it for you.
Zero fees.
Yep. مفروض. Yes.
Yeah.
Just a trick.
That's amazing.
Any specific conference?
Yeah. I think we could send you guys any conference if you guys have a research ready. So that's what I've been telling you guys, prepare something, prepare ideas, so that throughout this semester, the multiple workshops you guys will attend will benefit you to actually get done with the research. This is just an idea or overview about Cohort. Next week will be about bioinformatics. It's basically AI medicine or the technology in medicine, and I highly recommend you guys attend on Monday and Thursday. And for the second part, is just select appropriate journals carefully. There are some that, for example, if you just want to submit for the case of publication, it's alright, you can choose anyone. There's also Curious, it's a Q3 journal. It's like many students are publishing into it because it's easy to publish into it. Understand publication fees and guidelines. They might send it back to you. They're like, alright, we need to change this and this and this, and we require a payment of how much. And then fourth is do not submit to multiple journals at the same time. It's unethical because it's like you're committing to a journal. If you submit to one, that's it. You're committing to this journal. If you submit to another, it's like kind of like a bad way to treat the journal you're submitting to initially. So yeah, this is to sum up everything that we have. Yes, from Hassan. Yes, awarded Prophet Muhammad Salih, everyone. Yes.
Okay, Assalamu alaikum. I'm sorry for the interruption, but because I had a meeting and then I had another meeting at 4, so I had to leave. I'm sorry. I'm so pleased to welcome all of you to the first session in this semester for undergraduate research activities. As that is, we start today with cohort assessment.
Yes.
And then, inshallah, the next session will be on Monday. Bioinformatics with Dr. Reem. She is a very good researcher, postdoctoral fellow at the Research Institute, and she is amazing in bioinformatics. So but anyway, we are here, as Bara said. Yes, we are learning, and also Mohammed, inshallah, all the groups that are
with you also. Yes.
Are really a good researcher. And from my experience in this all academic work, I found that to be a doctor, clinician, and researcher, this is the top in the field. So not just a clinician, but clinician and researcher. Like in US, because my training was in US as a PhD student, then as a postdoctoral in US, that I spent about 9 years during the PhD and the postdoctoral fellow. I am a pharmacist, as you know, but I see the clinician coming to the lab, have training, doing some of research work, maybe coming for 1 month, 2 months, 3 months, and then adding to the paper for publication, getting training. This will really help them to learn to do the research, because as a clinician, okay, you are doing your clinical part, but of course you need the research, because you will see cases, you will see how can you translate this data that you can see from the patient every day into a conclusion that help in clinical guidelines maybe. Of course you need to have evidence, and this evidence is based on research, based on data. So how to analyze the data, how to do all of this. I confirm again, yes, during this stage, mashallah, I'm undergraduate still, so still the early beginning of your academic and clinical life. So we need just to see your evidence for doing research. So this is, yes, very important. Yes, attending workshop, doing the CBR with Dr. Amal, and this is very important also. Doing extracurricular CBR. So all of this, yes, give a hint that you did a research in your CV. About the conferences, just a comment, conferences usually publish the abstract, you submit abstract and they publish it. And when it is published, take a DOI, what, do you know what is DOI?
Yeah, cool.
Yeah, any paper published, it has a serial number. It's called the DOI, digital footprint. فالابstract, yes, it is published in a book, in a publication journal book, for example, related to the conference, and the abstract will have the names for the authors. So it will be considered, because it has a DOI, as a publication. But it will not, they will not help for publishing the whole paper, because usually you submit just what? Abstract. And this is the published abstract, because it will be an official publication for the applicant for the assignment. Yes, we can see sometimes some conferences here in UE like help for when after you attend and you present your work as a poster, as an oral presentation, then you can have your submitted abstract as a publication. And this is, yes, it is a good like proof that your work is published. That we need publication in the CV. Yes, during your stage, like don't fight with your colleagues who is the first, I am the first author, don't fight, never for this. It is like we need in our promotion, like after like I came here as assistant associate professor, so during the promotion, yes, they ask me for the committee in the university, like you need to submit, for example, 10 papers, 5 of them being first author, 2 of them review, 3 of them as a co-author, 2 of them with your student at your lab, PhD student or master student. So this is like very late in the academic life, you will be asked to be a first author. But when you submit your paper in your CV for, when you're applying for residency, for anything, they don't care that is like they will not, like, for example, hire you forever. So I'm not helping your promotion there, still in your early life. So don't fight with your colleagues. I am the first author. Don't worry. Right? So this is, yes, another important point. Yeah. We need just in your stage here a proof that you have, as a clinical student, as a medical student, to prove that you are also having, you know what research, what does research mean? Right? You take sample size, you analyze it. You have 2 groups. How you compare your data? What test did you use? So this is the main aim in your stage, right? And I'm really happy to begin our first session. Thank you for you are really. I work in many. I went of course in Egypt, work with students in Saudi Arabia, in US, and of course here. And you are really usually from the Sharjah, like you are amazing. All patches of life are amazing.
If you guys could scan the QR
code.
No, it's alright. No, thank you so much.